Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Anggun Gunapuspita and I'm from B class. Today, I want to explain about mental health, and I've prepared a concept map that's already behind me. And okay, I'll start the explaining. Okay, I will start from definition of mental health. What is mental health? Mental health refers to cognitive, behavioral, and emotional well-being. It is all about how people think, feel, and behave. People sometimes use the term of mental health to mean that the absence of mental disorder. According to the WHO, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution of his or her community. And then there are some factors that cause mental illness. The first is risk factor, and the second is biological factor. And about risk factor, there are some, that everyone has some risk of developing a mental health disorder, no matter their age, sex, income, or ethnicity. In the USA and much of developed world, mental disorders are one of the leading causes of disability. Social and financial circumstances, biological factor, and lifestyle choice can all shape a person's mental health. A large proportion of people with a mental health disorder have more than one of condition at the time. It is important to note that good mental health depends on the delicate balance of all factors and that several elements of life that the world at large can work together to the contribute of disorders. And there are some modifiable factors for mental health disorder, include socioeconomic condition, such whether the work is available in the local area, and occupation, and a person level of social involvement, education, and housing quality. And there is some non-modifiable factor include gender, age, and ethnicity. And the second factor is biological factor. The NIMH suggests that the genetic family history can increase the likelihood of mental health condition as certain genes and gene variants put a person at higher risk. However, many other factors contribute to the development of this disorder. Having a gene with links to the mental health disorders such as depression or schizophrenia doesn't guarantee that a condition will develop. Like with people without related genes or a family history of mental illness can still have mental health issue. Okay, and next I will explain to you about types of mental illness. There is three types of mental illness. Let me show it to you. There is three types of mental illness. The first is anxiety, the second is schizophrenia, and the third is mood. Okay, let me explain again to you. The first is anxiety. People with this condition have severe fear of anxiety, which relates to certain objects or situations, and most people with anxiety disorder will try to avoid exposure to whatever trigger their anxiety. And the second type of mental illness is schizophrenia disorders. Mental health authorities are still trying to determine whether schizophrenia is a single disorder or a group of related illness. It is a highly complex condition. Signs of schizophrenia typically develop between in the age of 16 and 30 years, according to the NIMH. The individual will have thoughts that appear fragmented and they may also find it hard to process information. Schizophrenia has negative and positive symptoms. Positive symptoms include delusions, thought disorder, and hallucination. Negative symptoms include withdrawal, lack of motivation, and a flatter inappropriate mood. And the last type of mental illness is mood disorder. People may also refer to the mood disorder as affective disorder or depressive disorders. People with this condition have significant change in mood, generally involving either mania, which is a period of high energy and elation, or maybe depression. Example of mood disorder include the first is major depression. It means that an individual with major depression experiences a constant low mood and loses interest in activities and even that they previously enjoyed. They can feel prolonged periods of sadness or extremely sadness. The second is bipolar disorder. It means that a person with bipolar disorders experience unusual change in their mood, energy level of activity, and ability to continue with daily life. Periods of high mood are known as manic phases, while depressive phases bring on a low mood. And the last disorder is seasonal affective disorder, or you can call it SAD. It means that reduced daylight triggers during the fall, winter, and early spring months trigger this type of major depression. It is most common in countries far from the equator. And the last point is treatment. Let me show it to you. There are three type of treatment. The first is psychotherapy, and the second is meditation, and the third is self-help. Okay, let me explain again to you. The first is psychotherapy. Psychotherapy, this is a type of treatment takes a psychological approach to treating mental illness. Cognitive behavioral therapy, exposure therapy, and dialectical behavior therapy are examples. Psychiatrists, psychologists, psychotherapists, and some primary care carry out this type of treatment. It can help people understand the root of their mental illness and start to work on more healthful thought patterns that support everyday living and reduce the risk of isolation and self-harm. And the second treatment is meditation. Some people take prescribed meditation such as antidepressant, antipsychotic, and anxiolytic drugs, and although these cannot cure mental disorder, some medication can improve symptoms and help a person resume social interaction and a normal routine while they work on their mental health. Some of these medications work by boosting the body absorption of feel-good condition, such as serotonin, from the brain, and other drugs either puts off overall level of these chemicals or prevent their degradation or destructions. And the last treatment is self-help. A person coping with a mental health difficulties will usually need to make change to their lifestyle or facilitate wellness. Such change might include reducing alcohol intake, sleep more, and eating a balanced nutrition diet. People may need to take time away from work or resolve issue with a personal relationship they maybe can harm themselves. Okay, that's all about mental illness. Thank you for watching. Assalamualaikum warahmatullahi wabarakatuh.